Thank you, Jeff. That's really helpful. And yes, the committee has already, of course, started thinking about these things, and so we do have a number of things. I wonder if you could help us a little to start out with on scope. Obviously, interventions can vary all the way from prevention of drinking to begin with, all the way through immediate events prior to getting into a vehicle or walking on the streets impaired, to all of the different things that can be done behaviorally or with technologies, with policies. Can you sort of scope out where you would think that it would be most useful for the for NHTSA to have us look, or what you would think are probably less fruitful avenues?
Sure. So I talked about scope a little bit, kind of in a vertical fashion. We need you to do the work on tools, to think about tools for us. That'd be very helpful. But we also need you to think about utilization of the tools and sort of social willingness. So that's kind of one dimension of the scope. We very much need your help in both of those areas. The horizontal reach, if I could put it that way. I feel like we should defer to you largely. I mean, we obviously need both population and specific modalities. We may. There's sort of a new era of thinking in road safety, of sort of a system-wide approach, and the committee may want to consider how system-wide changes could affect drunk driving. Some of this would include harm reduction, such as the changes in the infrastructure. So we've made some progress in the past with infrastructure changes such as rumble strips. Rumble strips are very effective. They're effective, we believe, at keeping even drunks in the lane. But they're also effective with people who are distracted and drowsy, and so they are a kind of a harm reduction approach. But I think they are very much within your scope of your interest. So I really would like to defer to you to sort of reach out as far as you think we can find productive solutions.
Committee members, if you can just tip your cards up as you want to make comments or ask things. Charles and then Jody. Charles, do you want to?
I was just wondering what NHTSA and other, I guess there are people that I would consider to be sort of psychophysiological researchers who have already studied the effects of various plasma levels of alcohol and things like that, on driving. And I just wonder, is there still need for that kind of research? What I'm just based on my talking to patients. And college students, oh my God, there's so much ignorance out there. I mean, I would assume that there's been a lot of efforts at education. I always try to get the students when they're freshmen, when they're first coming in. They don't realize, believe it or not, that alcohol is not a stimulant. It's a depressant. It'll put them to sleep. It'll kill them. And then the effects last a lot longer than you think. When you feel perfectly sober, you're still a risk, compared to when you were not alcohol intoxicated. In other words, these are very fundamental things. Do we need a campaign to try to educate the public, especially university-age kids?
I think there is a need for a wide range of interventions, and we do have to keep in mind, I think, that there are a range of target groups, and you're mentioning one of them, I think, which, so we have a population bulge aging out. Meanwhile, there's new drinkers coming in who are comparatively inexperienced and may not understand, the basics of blood alcohol content and what the consequences of 1 drink, 2 drinks, 3 drinks, 4 drinks for them might be. There's certainly a need for that, I believe. There are other target groups who probably have other needs. On the other end of the scale, we have alcohol abusers and addiction problems. Such solutions are probably less effective on that group, and so I think we need to keep in mind that we do have some market segments here, and that what works for one group may not work for another, and that we might need a wide range of approaches.
Jody? And then Linda.
So I was going to ask you that we are to come up with, say, 10, 12, I should say, ish recommendations. So that means we're going to have to cut them down from a bigger set. But I'd like to know, to what extent would things like the spillover be relevant? So, for example, when you say the rumble strip, that would be even better than you think, because it's affecting not only drunk drivers but others. So we could, the impact could be the only measure, like the number of deaths averted, or we could include the cost of the program, the cost imposed by the money cost, the cost imposed by others, the spillovers, positive and negative. So I want to know whether you think it's better to use a simple deaths averted by drunk driving or the broader framework. And I would say I think the broader framework is the better one, but I would like to know if it's okay we do that.
Yeah, that's certainly okay with us. We're concerned with road safety in general, but we're also, we're not opposed to progress in other areas as well. So we have methods for calculating the economic costs of alcohol-impaired driving fatalities, and I think our current estimate is $44 billion. Those are far-ranging costs, and there are spillovers, and I think since we're trying to raise this issue sort of into the national agenda, that we don't want to be sort of parochial about the benefits, that if there are widespread benefits for new interventions or new approaches that we're taking that affect other alcohol problems or even other social issues, I think that's terrific.
I was thinking of that, but also if something, for example, I gave the example of the taxes, that taxes can help some people, but then it can harm, this would be, as you said, less support for it, social support, if it's going to harm other people that drink without harming anybody. So it's the cost and the benefits both, I think. Yeah. Okay.
Linda?
So one of the things that we're talking about is the issue of whether is the goal to look at really decreasing alcohol-impaired driving or decreasing injuries and fatalities, because the interventions could be very different. And if you start talking about fatalities, you could be and injuries, you might be thinking of the impact that a trauma system might have, or EMS improvements. So it would go in a very different direction than looking at actually preventing alcohol-impaired driving. So.
Yeah, so interesting thing about road safety, it is so far-reaching. When we talk about a road safety system, we certainly include trauma care. And in fact, in our office, we have emergency medical services office, which is sort of a lead agency in the U.S. So we very much include that. Again, I sort of leave it to you, considering that sort of larger calling, the national agenda issue, if you feel like reaching out is a way to get the kind of attention that we need to get the drunk driving issue onto the national agenda, then I would say that's perfect. I think you're just going to have to make judgments about, whether it's at what point it stops as you expand further and further. At what point does it sort of stop contributing to the main point and start to dilute the impact?
David?
So I want to kind of read back to you what I'm hearing, because some of what you said doesn't appear in the written charge. And so what I'm hearing is that you have a priority on us thinking really hard about things like social movements, agenda setting, how you take an issue like this and move it up the national decision calendar, what it took to do what MAD and other groups did in the 1980s, what we can learn from that. Is that as I say, it's not on the paper we've got, but I'm hearing that pretty loudly from you.
Yeah, and I think you're the guy who could do that. Yeah, I mean, we need both, obviously. I mean, we need innovation on the technical level. I mean, we need better tools, but we've clearly got this problem about, sort of social willingness to apply the tools. And I honestly was very pleased to have you involved, Dr. Jernigan, and I think your insights in that area will be very helpful.
I didn't ask the question for
Looks like you'll have something to do on the committee. I mean, there is a difference, of course, between efficacy and effectiveness and promising, between what we know works in principle, what works actually in practice, and then those things that are sort of more hypothetical or, as you said, futuristic or bringing in from other fields. And even things on the horizon, some of the new technologies, we could magically transform the transportation system, or we have self-driving cars. Could you reflect a little bit about kind of time frames you're thinking about? If we're talking 2075, my guess is the whole highway traffic system is going to look radically different. Yeah, they'll pick us up and drop us where we need to be and magically transport us. So I wonder if you could talk a little bit about how you're thinking about time frames.
So that discussion's happened in many of our road safety forums recently because of, now we're thinking about self-driving cars. And so at some point in our future, and I mean, I'm also a technology optimist, and I believe that at some point in our future that our road safety system will accommodate human behavior rather than vice versa, that we'll no longer have to shape behavior to fit the system. So when we have self-driving cars, we humans who tend to be distracted and tend to fall asleep and tend to drink alcohol will be much safer. That self-driving car era is, though, to my best understanding, probably 40, 50 years away. It's a long time, and if each of those years is costing us 10,000, or it looks like this is probably we're rebounding from a 10-year decline now, so it's going to be more like 12,000, 13,000. If this is costing us 10 or 12,000 lives per year, that's too many. I think we're thinking of short and midterm. I mean, we would like things that we can start doing now, obviously, to turn the trend around, and things that we can do in the next decade, maybe over the next 20 years. Policy change isn't real quick, but we're unwilling to sort of maintain current activity and wait for technology to fix it for us.
Jeff?
So you presented data to us that dealt with sort of overall aggregate level. I'm wondering how much the statement of task allows us to think about disparities and differences within the population. So, you know, prevent injuries and deaths from alcohol overall, but a health equity perspective part of the thinking.
Yeah, certainly, and I think that's has to be sort of the pragmatic approach. Drinking behaviors are not uniform. They're highly variable in a population. There are target populations sort of based on lifestyle and based on demographics and also based on preferences, individual choices. I think we need a pragmatic solution that can get us the furthest and get us lasting change. I suspect that looking at disparities within the population is going to have to be a part of that.
Anyone around the room? Any final thoughts, Jeff? What else should we have asked you?
I think those were terrific questions. Again, just once again, I'm very grateful for the Academy and for each of you to devote your time and energy and brain power to this problem. It's a problem that very much needs your help. So I thank you very much.
Excuse me, but I just have to, since in the discussion, challenge you a little bit, your pessimism about self-driving cars. Because I've ridden in it, and 40 to 50 years.
Optimist, he said.
Yeah, so I'd like to hear your rationale.
So we've had some interesting discussions about this question. Self-driving cars are, again, I'm a technology optimist. I believe that is the proper human response to this systemic issue. Unfortunately, the way technology is commonly deployed in our population, it starts at the wrong end for us. When new vehicle automation is introduced to the fleet, it will be it'll be the people who need it least who will buy it first, and the hardcore drunk drivers will be among the last adopters. So, so even though self-driving cars may become commonly available in the next decade, it will take a number of decades before they filter down through the population and we start feeling we start feeling relief from drunk driving from that technology. Now, we're trying to be clever about issues of, about deployment of these kinds of technology and see if we, through clever policy or market incentives or something, if we could get self-driving technology into the hands of the worst drivers first, but that's sort of counter to market forces. So we haven't, we don't have answers to that yet. But that's, so I do believe that I'm very positive about the potential. I'm I don't know, realistic, I would say, about the time it's going to take to achieve that benefit in this particular audience.
Joanne and then David.
Mechanisms in the law that people are obligated to use the blow,
Yeah.
yeah, so,
Interlock.
yeah, so I mean, couldn't there be a similar kind of requirement that they get a self-driving car?
Yeah, that would be ideal. If we could get the highest risk drivers in, if we could get take the steering wheel away from the highest risk drivers, that would be a good solution. If you have a strategy for doing that, then we'd love to hear it.
Joanne?
Jeff, I have to ask the difficult question that I know we're probably all thinking about, and that, of course, is cost. And in our analysis with what works in principle and what works in practice, when we're formulating these recommendations and thinking about these 10 or 12 new interventions and looking at technology and things like that, there has to be a thought in our heads because, yes, in the perfect world, the worst offenders have the self-driving cars, but we have people today that can't even afford an ignition interlock on their vehicle, and the states are now having to incorporate the cost. So I guess I'm asking for a little guidance, and I know you can't tell us overarching, but where should we fit that in the continuum with the time frame you've kind of given us, the short and midterm enactment, versus, well, in conjunction with our consideration of what works in principle and in practice?
So, I mean, that's a central question, obviously, and I think you have a couple of leverage points there. One is there is a social cost of maintaining status quo, and it's, by our estimate, $44 billion per year. Now, that's helpful, but I recognize that it's, that's not money in your pocket. So I think that's one thing you can work with. The other is sort of this larger charge of national agenda. If we are successful in getting drunk driving sort of elevated to the national agenda, then resources become available because it becomes a social priority. So some of those resources may be financial, but in this area, a lot of them will be willingness to make concessions in other things, like philosophical ideas of individual freedom. Again, it's a social cost that is held very dearly, and our willingness to pay is affected by that national agenda.
And then we have a comment online.
Yeah, just more of a comment on the exchange about self-driving cars. Full disclosure, my son is a race car engineer based in Southern California. And there is an American romance with the automobile, and there is a nexus of risk that I think we're talking about when we talk about cars and car culture, and this is part of why addressing that normative environment, I think, is so important, and why I'm glad that people like Jeff are on the committee. So that's just, that's a comment on that piece, that I think the technology may be there, but the normative climate to adopt that technology wildly. Let's just say in my son's circle, self-driving cars are about as popular as the Prius.
Okay, no marketing ploys here.
But I did want you to look into your crystal ball a little bit for us on where the ignition interlock technology is and where alcohol sensing cars, the steering wheels, because I know NITS has been involved in backing that kind of research.
Yeah, of course, and those are both, I think, very positive, very promising technologies. They're related but different. You know, the current ignition interlock objective is, you know, part of a response to noncompliance. You know, and you can look at that as protecting the community or punishing the offender, but in either case, the action is the same. It is requiring that the offender have installed in their car a device which prevents the car from starting unless alcohol-free or very, very low alcohol content breath is detected. So in you know, simple terminology, it's sort of punitive. The driver alcohol detection system for safety is sort of an extension of the same idea, an extension of you know, the technological capability of detecting alcohol, you know, in very minute proportions. But it is envisioned as a population intervention, which could be widely fitted into new cars as original equipment, and because of its complete passive nature, would be acceptable for daily use by car owners and would provide protection in that car, for the life of that car. So they are, you know, right now sort of on different tracks, but they could come together. It could be that that if all cars or nearly all cars had such technology, then the technology could be adjusted by, you know, at the direction of the criminal justice system to be maybe more tightly controlled for those who are now receiving the, you know, the punitive ignition interlock. So I think there's lots of potential there, but you know, the sort of the central technological capability is, you know, our ability to reliably, you know, quickly, reliably, accurately detect blood alcohol and, you know, immediate impairment.
Right. Do we have a comment from the web, Marjorie?
This comment is from Ricardo Martinez, a committee member listening in online, and he says, today, what do you see as the greatest challenges to getting alcohol-related fatalities a national priority, and what are the greatest opportunities?
Can you write a report?
Yeah, excellent question from my former mentor, Dr. Martinez. So I feel like we are coming to the committee to help us in reaching this objective of moving alcohol-impaired driving into the national agenda. That involves my conception of this national agenda is and people like Dr. Jernigan would know better, but it seems to be something that's finite. There's a finite amount of attention, and there's a finite amount of time in every day, and individual attention to social issues. Alcohol-impaired driving was once among that list of issues that are, you know, discussed, debated, considered, and acted upon. It isn't right now. Getting it back on there will involve displacing other things, and that's a challenge. And that's a challenge that I believe requires sort of a large footprint. That is, it requires a very compelling case from a credible group that has a very broad knowledge base to do the lifting. So I think that's why we came to you.
Great. Well, thank you so much. Thanks for all those comments, and it gives us more grist for our mill here and helps provide some great direction. And again, thanks for your support.